Next, we will have a discussion and Q&A session throughout the webinar. Please submit your questions using the Q&A feature. We value your feedback and plan to send a brief survey asking for your input about today's webinar and ideas for future event topics. Finally, we encourage you to get involved in our COVID Commons community of practice by visiting asucovidcommons.com. Now that housekeeping is behind us, I'll turn it over to Mara.
Thank you, Nate, and hello, everyone, and welcome to today's webinar. For those of you who have been with us before, let me say that today's format will be a little different from our previous webinars. As you know, our focus is back to the workplace, how employers and employees perceive the good, the bad, and the ugly. We will focus our discussion on 4 related topics. First, COVID testing in the workplace. Second, vaccinations. Third, employee well-being with an emphasis on mental health. And fourth, the future of work. Nate and I will present findings from our second phase of the ASU newly released employer survey. And when I say newly released, it was just sent to the press literally 3 minutes ago, and we will add that to our chat. But what we're going to hear from today is not only the ASU survey, but hear from our panelists about their findings and their work in these 4 areas. Before we get to this very impactful data, I'd like to start with short intros to our panelists, and then we will go through those topics again: testing, vaccination, employee well-being, and the future of work. So our first panelist is John Dooney. John is the Senior Director of Thought Leadership at the National Safety Council. John oversees the Campbell Institute, the Global Employee Health and Safety Center of Excellence, as well as the SAFER Initiative, the Safe Actions for Employee Returns, the National Safety Council's COVID-19 response effort. The National Safety Council has more than 16,000 members and has been a very active voice in the midst of the pandemic. John comes to us with not only experience in NSC, but a career around quality management, project management, coalition building positions. Our next panelist is Brent Berner. Trent serves as VP of Research at the Society of Human Resource Management. Some of us call it SHRM. SHRM is the world's largest HR professional society, representing more than 300,000 members in more than 165 countries. I believe there are only 192 recognized countries in the world. So we're going to say essentially everywhere. Trent leads a comprehensive research program that identifies workplace needs, conducts research, and develops research-based solutions to allow HR and business leaders to further the goals of their organization. Trent also comes with tremendous experience, having spent 15 years at Walmart stores, leading the global HR centers of expertise around the world. And our third panelist is Larry Gadea. Larry is the founder and CEO of Envoy, a workplace platform focused on making workplaces work better. Envoy has created products to help their current 14,000 customers interact with visitors, manage delivery, simplify in-office logistics, including conference room scheduling. Used to be a very big deal. And now it's building products not just for today, but truly for the post-pandemic era. So with that, you've heard a little bit about our panelists. You'll hear from them in a moment, but I will start with the ASU survey and our first topic of testing in the workplace. And this is a key area for us at ASU and our work with the Rockefeller Foundation around testing. So I'm going to share my screen now. And what you will see, and hopefully that this works, at least if the panelists can give me a thumbs up that you can see my screen. Thank you. So Nate and I and the entire College of Health Solutions at ASU are proud to present our Back to the Workplace. Are we there yet? Key insights from employers one year into the pandemic. This survey, and you'll hear other surveys, are very broad. We're pleased to have responses from more than 1,300 facilities representing 24 industries. To give you a sense of the top 10 industries, just look over here of the top 10 from left to right. It's a global survey with responses from 31 countries, but the vast majority were from the US, about 70%, and the UK, about 24%. So the core here is to give you insights and for all of you employers to benchmark what we've seen in our survey versus what you're doing. The first area that we'll have a brief overview of is testing and contact tracing. Testing is an area that has been critical to confirm the work that is done on mitigation and vaccination. And compared to our first study in the fall, there's been a tremendous increase in testing, where we saw less than 20% of companies testing at that time. Today, we see 68% of companies testing some or all of their workers. About 2/3 of those are requiring it, and about 2/3 as well have that testing once a week. That is the most common way to do testing. But broadly, we've seen this increase. It's our belief that this is all about the fact to confirm and measure the success of mitigation efforts. Mitigation works well, whether it be masking, hand washing, as well as vaccination. But with testing, you get the confirmation of that information. Throughout this webinar this morning, you will see a few slides. We will point you to the various surveys so you can go into more depth on each of these different areas. So I will move on from testing to vaccination. And on vaccination, I'd like to start with John to talk about how the National Safety Council looks at vaccination.
Thanks, Maura. And yep, I'm John Dooney. Great to be with you all this morning or afternoons it may be for you. We've spent a lot of time over the past year, as everybody else has, working with our members and our clients and customers, learning what they're doing, helping support them in various ways. And since December, the focus has been front and center on the vaccine. So we published this document about a month ago now that was laying out the groundwork, maybe about 6 weeks ago, the groundwork of what we were seeing employers doing in the field. And it's a spectrum that ranges all the way from simply communicating about the vaccine and fact-based information about the vaccine, whether that's CDC guidance or otherwise, all the way on the other extreme end to going so far as to mandate vaccination or soft mandate vaccination by some other mechanism, such as requiring it for return to a physical environment, even if one's not requiring it for workers generally. So those are sort of the two extremes. And when we surveyed and talked to organizations, the vast majority of them really fall along a bell curve, where very few are simply communicating and not going any further, and very few are mandating directly. And the vast majority are either encouraging or incentivizing vaccination in the middle. And generally speaking, we've seen most of that end at encourage. When you get into incentivization directly, things become a little bit trickier from a legal perspective and a discrimination perspective. And certainly the EOC has a lot of guidance on what's permissible and not, although there's a lot of gray area still at this point in the vaccination effort. But things such as ease of access, increased ease of access, paid time off potentially for taking the vaccine and recovery, positive peer-to-peer storytelling. These are the sorts of common approaches we've seen most employers take. What I think differentiates our approach to this, or our point of view on this from others that we've seen out there, is that arrow at the bottom of this chart, which lays out that we really want employers to think about the risk profile and exposure level of their various work cohorts. And that can be quite different for folks who are working, in an office environment versus in a manufacturing environment or a retail facing, public facing sort of environment. And each cohort within your workforce requires potentially different approaches along the spectrum, or different tactics within this set of tools and things that you can deploy. So that's true of any safety intervention, but certainly true of the vaccine uptake effort.
John, that was really helpful, and I think lays out the structure for which we can talk about each of the different studies. Thank you for that. Over to Nate, because you'll hear a little bit different areas and a little bit more detail on each of these areas. Nate?
Great, thank you. So for our respondents, nearly 60% of them plan to incentivize employees to be vaccinated. And then shortly, Trent's going to share some fascinating research that SHRM did about vaccine incentives and employees. About 84% would allow vaccinations to be administered on site if there were supplies available for them. And about 60% say that they plan to require employees to demonstrate proof of vaccination. And then for our next slide, this is the most interesting finding that we had for our vaccination study, is that nearly 90% of employers will either require some or all and/or encourage vaccination for their employees. And so I'm going to turn this over now to Trent from SHRM to share what they learned from an employer and employee perspective regarding vaccination.
Over to you, Trent.
Thanks, Nate. Hey, just real quick, interesting segue about the EOC comment. So just yesterday, Johnny C. Taylor Jr., our CEO, was one of 5 testifying members in front of the EOC and talking about this exact issue, because the EOC is looking to release new guidelines for the vaccine and return to work. And so SHRM was testifying using this data on Capitol Hill to inform the EOC. And so our research looks at not just employers, but also employed Americans, the worker perspective. So everything we talk about here is probably probability-based data. So when we say working Americans, we truly know it really represents all working Americans. So the good news, let's start with some good news. Over 1/3 of employed Americans have received a COVID vaccine, compared to 64% who've not. However, if you look at it by age group, nearly 60% of baby boomers have received the vaccine, and only 19% of the millennials, Gen Zers have received the vaccine. And we know that 48% of workers with household incomes of 100,000 or more has received the vaccine, which is 30% higher than household incomes of between $30,000 and $60,000. But the other fascinating finding we had is that 28% of working Americans say they would rather lose their job than get the vaccine.
Wow.
However, what we also asked, once we found out, they said they will not get the vaccine no matter what. Then we said, well, what if your organization offered you something, such as money? All of a sudden, 24% of that group that said, no way, all of a sudden they're saying, yeah, I get it for some sort of money. And that could be gift cards, gas cards. We're seeing that increases to HSAs, et cetera. 21% said, give me some time off, additional time off, PTO, and I'll do that. Which, by the way, you may have heard the White House just last week released the new tax benefit for organizations with less than 500 employees to actually give employees time off to get the vaccine and to recover if they have side effects. That's now a tax deductible effort. Gift cards, like I mentioned before, 16%. And the really surprises it wasn't higher was the on-site vaccine at no cost. Only 10%, almost 10% said, yeah, that would change my mind. But again, even those that said they wouldn't, even something small as a $25 gift card or a $30 gas card or a $25, $50 HSA additional benefit would change their mind about the vaccine. So when we ask why are you not interested in getting the vaccine, I was going to focus on a few of these. The vast majority said, I'm concerned about possible side effects. Likewise, that same group, 58% said, I'm going to plan to wait to see if it's safe. 41% said, I just don't trust vaccines in general. And then 40% said, I just think other people need it more. What was interesting is 25% said, I don't trust the government in general. And you can see the rest of the stats there. But again, the possible side effects in the waiting and seeing is also encouraging, because as more people get the vaccine and we're seeing such few side effects, we believe that's going to change people's minds, given the fact that this vast majority of people are concerned about, or communities are concerned about, those top 2 issues.
Thank you, Trent. This was a great sense of your data and how that comes together. Before I send it over to our last speaker on vaccinations and the work that Larry and Envoy have done, let me say to our audience, please put questions. We're going to stop after each section now. After vaccines, please put your questions in the Q&A function or in the chat function, and we will have a chance to answer them after each section instead of waiting until the end of the webinar. Larry, over to you.
All right, thanks for that. So, all right, so we did a study of about 1,000 US employees, and this was collected in February of this year. And the study told us, as context and premise here, 66% of people are worried for their health and safety as they return back to the workplace. And those concerns are very, very interesting because it's kind of, additionally, we found that 61% of people were concerned that their workplace would relax COVID measures too early such that they could get people back in. So people feel there's a little bit of pressure. Now, when looking at the study a little bit closely, and kind of what this slide is showing here is very interesting because the mandatory vaccines seem to be what put employees' minds at ease. 62% of people believe that it should be mandatory for vaccines to be gotten before returning back to the workplace in person. And this is really interesting because it's like people are demanding this, and 62%. Now, another of the total set of people, the people that were only in tech and business kind of services, 76% said that it should be mandatory. So these folks are very much saying like, hey, they want this to be over and they want to know that their area around them is going to be safe. So very interesting to see this.
Larry, thank you for that. And thanks to all of our panelists because there were very interesting questions here. Let me open it up. We've started to get questions in the Q&A. The biggest question is, well, a lot of this data is optimistic. The ASU survey, probably the highest one at 88%. The tech one that Larry talked about, high numbers in the tech sector. What are the sectors where do you have a sense that nobody wants to get vaccinated? We know that this is not 100% of working Americans, that there is a core group. Trent, if I take your numbers, maybe 21% absolutely won't get vaccinated, even with incentives. Do you have a sense of the demographics there, either by industry, by age, in any way? So we really understand, because I think it looks like the tech sector is one in which there is broad support for vaccination, but certainly not everybody works there. Trent?
Yeah, so a couple of things. First of all, thank you. So we're finding, certain places that have a much higher uptick, especially looking at losing their job, such as, healthcare, in-person education, schools, et cetera. But what's interesting is when we looked at the industries regarding uptake of the vaccine, although we saw a few minor differences, we didn't see, besides the ones I already called out, really true statistical significance regarding the employees that are interested, not interested. So it cuts across industries. And like I said, what I mentioned for us, the most interesting thing was age and income was more interesting because we truly found significant differences. Older working Americans are much more interested than the millennial Gen Zs, and the households over $100,000 income, 48%, compared to 35% of household incomes of between 30 to 60,000.
No, explain a little bit more about the incomes. Which way the 48 and 35 were more interested in the vaccine?
Sure. So 48% of the U.S. workers' household incomes, 100,000 more, have received the vaccine. So $100,000 or more income, 48% have received the vaccine. 35% of household incomes 30 to 59,000 have received the vaccine, and only 30% of households making less than $30,000 have received the vaccine. So the very clear difference, what we're finding statistically and just face value, is the fact that older workers versus very younger workers, and then high income housing versus low income housing. And you're talking, 48% compared to 30% of those making less than $30,000 is stark.
So Trent, we had a question from Phyllis Whiteley in the chat, and I'll ask everybody. Larry gave us some sense of his survey was about 1,000 Americans. How many people were in your survey, Trent?
So it was 1,000, but it was also U.S. probability based. So it was also then weighted for U.S. population.
Super. I really appreciate that. And John, I assume that your data and your structures are from your 16,000 council members?
That's right. And just to tie on to Trent's points, I think what he's describing is potentially both an attitude issue as well as an access issue. So the different dimensions of those polls are two different battles to be fought, right? So
that's why we were surprised that only 9% that said having the vaccine on site would make me more willing to get it, because lower income household in retail, hospitality, et cetera. Having access to that vaccine is one of the big issues we believe exists. And so again, that's why the offering vaccine in the workplace was so much of a surprise to us.
Super. And I'll answer it for the ASU study. We had 1,300 facilities, 1,100 plus companies. Each facility was filled out differently, particularly if it was in a fundamentally different location. 75% of which were 200 employers with 250 employees or more, and 35% had 1,000 employees or more, so skewed to larger businesses. Next question on vaccination is incentives / information communication. We've had some questions in the chat. How do you deal with anti-vaxxers? What do you think, given what you know now and each of you within your organization, what do you think are the most effective ways to incentivize? And I'll add too that I've enjoyed in the last I haven't enjoyed in the last 24 hours. West Virginia has done anyone between 16 and 35 that gets a vaccination gets a $100 savings bond. And if you'd already gotten a vaccination, you still qualify the savings bond. And a very different one, my favorite, Krispy Kreme donuts. You can go in every day with your vaccination card and get a free Krispy Kreme donut. This is not an ad, but it's been written about in the press and no purchase necessary. So can each of you give us some sense of what you think are the most either interesting or effective ways to combat anti-vaxxers or incentivize, either a carrot or a stick? Larry, you want to start, and then over to John and Trent?
Sure thing. Yeah. So for us, here the general view that we're seeing with our customers is that people are coming in when they feel it's safe. The anti-vax / like misinformation piece of it is pretty minimal. And I was quite surprised just in San Francisco as well. Like there's a lot of folks that are very concerned about like, hey, let's make sure everything's really safe. And when we announced with our own company, hey, we'll be going back, we'll try for May. People were very much like, all right, this is exciting. And I was very surprised because I was very touchy about the topic. I didn't want to go fully into it because like there could be people that are still kind of iffy about it. So I think people will naturally go in because they just want to see each other again. And I think that that'll be the driving force. And then at some point also, and the numbers change a little bit, but like at some point we will have that herd immunity, which will make this a non-issue. But that's just my general view as to, I think the problem won't be as big as could be. So that's my view on it.
Super. John?
Yeah, just speaking on a macro level, I think, one of the ways to combat this sort of thing is the large messaging campaigns that are taking place with groups like Rockefeller, the Health Action Alliance, and other entities out there who are doing their best to really push one consistent message about this to the employer community in order so that we can have our ducks in a row in how we talk about this. So we're part of those kind of coalitions and groups and definitely support that approach. But on a micro level, we've certainly seen this, and our internal surveys show that our attitudes and opinions about the vaccine broadly mirror the country's attitudes about the vaccine. So our approach has been internally, and what we've seen a lot of employers do is really meet people where they are. And there's an increasing trend to kind of get away from the hesitancy language or the anti-vax language and talk about the workforce as a family, as a group that we want to get back to and return to doing things with, and really try to not put the burden on the people who maybe don't want to get the vaccine at this point, but really try to softly blend support and get people to that point more slowly or more naturally than kind of going head on with it.
Super. And over to you, Trent, and then I'll have you have the last word on vaccination, then we're going to move on to mental health.
Sure. Let me start by saying we did some research that's not here on what doesn't work. What does not work to encourage people to get the vaccine is like showing political figures getting vaccine, showing sports figures or prominent figures on TV. We have research that Employment America says that that will not convince us. We want to see our family members, and again back to monitoring symptoms and those kind of things and side effects. So we know that doesn't work. One of the things that we SHRM talk about is there is not a right answer. It's what's the right answer for your organization. However, companies that give $25 gift cards, it might not mean anything to someone who rides the metro. So for us, it's about how do you offer multiple incentives and let the employee choose what's best for them. And so, we're seeing gift cards, we're seeing gas cards, we're seeing Metro cards, we're seeing HSA. But what we're finding is it doesn't matter the amount of money, which is really fascinating. It's a matter of, do you or don't you offer some kind of incentive? The employees want to know that you as an organization are willing to invest in them if they invest in getting this vaccine. And so that's what we found as we look across all of the industries and across all the different sectors.
Super. Some of that is counterintuitive. So really, really appreciate that. And again, we'll send you links both during the session and afterwards, so you can read about each of these surveys in more detail. So now we're going to go to our third area, which is one that I would say until recently, really pre-pandemic, it was always said in a whisper. And I think key now is it's not in a whisper. Employee mental health, individual mental health is absolutely critical. So over to you, Nate, to describe the ASU findings in employee well-being and mental health.
Great, thank you. So for this section, we asked employers how their perception has changed regarding employee well-being during the pandemic as compared to pre-pandemic conditions. And the employers responded that there were increases across the board, both positive, including in engagement, productivity, and morale, but also in the negative sense, including mental health concerns and burnout. And 77% of employers indicated that employee mental health well-being has become a top priority for them. And finally, 50% of employers reported an increase in the use of available company resources related to mental health since the pandemic began.
Super. Thank you for that, Nate. And now over to you, Trent, to get it from the employee perspective. What were employers seeing it the same way employees were seeing it?
So we've got some good news here. So you can see we looked at 5 different variables, and we tracked it from April 15th of last year, when it truly hit, or it was real at that time to everyone, through just March 29th of this year. And you can see that we show the trending data. And so if you look at as employees, do you feel down? Do you feel depressed or hopeless? It was 23%. Almost a quarter of working Americans last April said, yes, I feel down, depressed, or hopeless. Good news is it's only 13% now. Now, as we get the vaccine, we hope to see it drop even further, but the good news is a 10% drop of feeling hopeless or down. Likewise, a 9% drop regarding feeling bad about themselves or that they're a failure. 7% little interested in pleasure or doing things, again, trending in the right direction. Down 5% of working Americans that said they have trouble concentrating on things. Down from almost, again, 22, almost 1 in 5 Americans, or more than 1 in 5 Americans said they had trouble concentrating last year during the April timeframe. And then a decrease of 8%. Feeling tired or having very little energy. Again, all symptoms of depression. So the good news is we're trending in the right direction. We expect further declines, and we'll be tracking this throughout next year to make sure that we, to find out, are there events that occur that we can figure out how to minimize going forward to maximize people's engagement in the workplace and decrease this important information. So, talk about mental health. So we said, back to work. You can see we've been back to work since March. And when again, those exact same 1,000 employees, working Americans, what would make you feel comfortable at work? Half of working Americans said the number of employees in the workplace is important to us. Social distancing. Think about, the way offices are set up. 45% said the number of people wearing PPE, such as masks. And so many organizations require, you wear masks. In my office, I don't have to wear a mask, but as soon as I leave my office, I've got to wear a mask. 42% said the quality of safety policies and programs in place. And that's formal written policies that are enforced. So for example, if you see someone in the hallway that's not wearing a mask, you must report it to HR. So that person can have a conversation. 42% social distancing. Again, common sense, but 37%, over a third of work Americans said, I need cleaning supplies that are provided to me. Not that you do it yourself. I want to clean my own office. I want to do my own. And then again, a quarter number of people who are vaccinated at the workplace will make people feel more safe in the workplace. And then the time frame, what is the right time frame for the right industry, the right company at the right time? And so if you think about, some organizations have not had the luxury of leaving the workplace. And so it's not, again, a one size fits all. It depends on what's best for your organization. And we'll talk more about this last one when we get to the future of work.
Thank you. John, over to you.
Yeah, thank you. Don't have some, we're fielding a survey right now on some of these topics, but I just wanted to put a little bit of a wider lens on some of the mental health topics as to how National Safety Council is coming at them. We've been tracking this issue since the start of the pandemic as well, and it was built into our framework in the very early days of the pandemic. When a lot of folks were focusing primarily on the physical and kind of medical dimensions of the crisis. So I appreciate that SHRM's been there alongside that as well. So we're focusing on how leaders and supervisors can show up and understand these issues better, going beyond EAPs and the traditional resources we've had for mental health. Those muscles weren't super strong for a lot of organizations pre-pandemic. They needed to get strong very fast, and they now need to remain strong. One of the other areas that we focus a lot on at the organization is impairment, and that includes impairment through substance misuse, fatigue, stress, other sorts of dimensions. So we know that a lot of folks have been leaning on, coping mechanisms, including, alcohol. For some folks, opioids. We've seen opioid use skyrocket over the past year. So we're really keeping an eye on the long tail of some of those issues. The other two that I have here on the slide, we can't, in some ways, this last year has been the two things that you can't separate out are the pandemic and the social justice and injustice, things that are happening in the United States in particular. And so, these also weigh on us from a mental health perspective, and they help us think about how we need to show up differently at work, not just because of COVID, but because of all these other things. And that leads me to this last statement. Our CEO, we were talking about psychological safety, and she spit back the idea to me of what that means as the fact that you have to be safe. You must feel safe. You must be your whole self at work. You must be able to show up, speak your mind, not just feel physically safe, but feel mentally safe and respected as well. So that's kind of the broad framework we're coming at this issue on, and our impairment practice and our workplace practice are working together on resources to that end to help employers.
Super. Thank you, John. And I know you'll make available some of these resources so people can read about these considerations. I'm going to take off on one of the questions in your last statement, John. To be safe, you must feel safe. That for employers has been the reason they continue testing. There are a bunch of questions about the fact that as vaccination rates get higher, or you're in a small business and you think or everyone's been vaccinated, why do we bother testing? Well, I will say, as good as the vaccines are, and they are very good, 95% protection is as good as it gets, but it's not 100%. And that to be 100% comfortable from mitigation vaccination, testing provides confirmation. So as we're seeing broadly in schools in the US and around the world, that to give that final dose of confirmation and comfort is testing. And that's been key, that the cost of testing and, quite frankly, the hassle of testing has gone down so much that you can do a quick nasal swab, you can do a quick spit and get an answer within 24 hours, if not within 24 minutes, and therefore go forward. So while there's been, I'm going to guess here and predict the testing will continue to be stable, maybe a little down. But when people get back into the workplace, you're going to see the testing numbers increase, particularly with rapid tests. So now for everyone, we got another interesting question. How do you tell the difference, whether it's an employer or in your surveys, between those who are truly hesitant to go back to work because they're frightened and those who prefer to work at home? How do you differentiate? Is it important for companies to differentiate from those people? And Trent, I'll start with you on this one.
Well, you're kind of alluding to an upcoming slide that we're going to talk about in a few minutes. But again, there is not a right or wrong answer. For white collar jobs that can be remote, we're seeing a huge shift in that. I mean, sitting in Alexandria, Virginia, the number of open office space is ridiculous now based upon the number of people working remote, which means the cost per square foot to either purchase or rent is falling like crazy. Yet the housing prices are continuing to increase just $2,000 to $3,000 a day. So again, there's not a right or wrong answer, because it's not a remote work option if you're in a retail organization, in a store, or a distribution center, or a manufacturing environment, or a healthcare setting. So we're seeing is, in those situations, organizations are, like I mentioned before, telling employees what we see, companies that have a really good communication process that says, here's what we're offering when you come back in the workplace. You're going to have cleaning supplies. You're going to have masks provided to you. You're going to have 6 foot or more apart between workspaces, et cetera. And we're sharing weekly what percent of our employees have the vaccine? Because we want people to feel more and more safe as they come through. Now, it is self-report, but it's really accurate. And so what we're finding is, there's not, again, one right or wrong answer, but we're seeing massive shifts to remote work, which is causing HR to really refigure a lot of things. There's a lot of companies that, when this whole thing started, said, yes, we'll be back to work in 6 months. When we asked back in April, over half of them now are saying, we're not sure if we're ever going to return to the workplace. So again, it's been a shifting perspective, but we do ask the question, if you return to work, what would it take for you to do it? Then we ask those individuals, does your job require you to go back to work? And if so, what would you feel safe? That's how we differentiate with our employee base.
Super. That's a great sense of it and a balanced sense of what's happening. Larry, do you want to add to that?
We're going to cover it in a second, but one of the things that we're seeing is that it doesn't have to be an extreme. It doesn't have to be 0 days a week, and it doesn't have to be 5 days a week in an office. It can be a mix. And the concept of hybrid work is basically taking over everywhere. For companies and people that can work from home, a lot of people can't, by the way, and most people actually cannot. But in that they have equipment, they're in a warehouse, they're in retail, all that. But the folks that can, they also don't want 100% at home or 100% at the office. The majority want a combo. And the hybrid work concept, knowing when people are there and scheduling so groups of people are together is really where we see the future and where we're seeing demand as well. So it's a very interesting new trend that I'm really curious to see how it builds out.
Well, you know what? Everyone in answering that question talked about the future of work. So I'm going to jump into that and we'll come back to broad questions either on the future of work, vaccination, or mental health. But I just want to remind people of one thing that Nate said, which I think is incredibly powerful for employers out there. 50% of companies see the increase in employees using mental health resources. So a lot of companies perceive they can't afford it, it's tough to do, but this burnout and stress is real. So I think all of our surveys, slightly different numbers, would say it's critical for institutions to have some way of employees getting through that so they're not just alone in their house with their dog.
Hey, Mara, real fast, do you mind if I real fast share one thing that gets to this point? We asked employers, what's the main challenge for returning employees to the physical work environment? And 26% said employees just don't want to return to in-person work. But 24% said that it was the safety of employees and the employees feeling safe at work. And so we see that playing out in our survey as well.
Thank you, Nate. That was actually critical and a perfect setup for our fourth area, which is about the future of work. And I will say, when we talk future, some of this future is this quarter. It's not 5 years from now. It's what's happening now and what's going to happen in the future. So on this one, I'm going to start with Trent and then John and Larry.
Yeah, so thank you. So we talked about just a few minutes ago about the return to work. What we're finding is even with the vaccine, even with the huge uptick we're seeing in the United States, over half of working Americans are saying, if given the choice, I would rather permanently work from home. Now, I'm not one of those 52%, but what's interesting is not just over half Americans say they work from home, over a third of working Americans said that they would take a pay cut to work remote. So think about working remote. There's a CEG play here. It's corporate sustainability. There's less office space, which means less carbon footprint, happier, more productive employees, and potentially recruiting new candidates with remote work options may lower your costs as well. So what we're finding is over a third of working Americans said, I'll take a pay cut to work remote, which again, if you asked that before the pandemic, would you take a pay cut? No. And now over a third. So again, there's not a right or wrong answer, but did want to share with you that, what we're finding is it's a changing environment. And you've got to stay close to your employee base because, we talk about unemployment still around 5%, but in many industries, it's still really hard to get talent, especially in some of your more on-site positions. So again, we're finding there's that mix where all possible.
And Trent, this is a broader question, but you had said that you're going to continue doing this survey. So
Correct.
This is not a one-time?
Correct.
Super. So with that, National Safety Council, you guys do such a good job putting together a structure around this. Can you tell us how you think about the future of work?
Yeah, absolutely. So you can kind of see it here, and there's a broader document and an infographic that goes with this that you can grab on NSC's website. But I sort of hunkered down at the end of December and said, what have we been hearing from all the surveys, all the interviews, everything we've been seeing? What is it telling us? And this is kind of what came out the other end. That there are three kind of massive pillars of change here. One is about the way we do work, where we do it, the work modalities, and I think that's a lot about what Larry's going to talk about most likely. There's the worker expectation piece, and Trent touched on that a little bit. We spend a tremendous amount of time in the safety and health space talking about the power of habit, usually in terms of how it enables safety, adherence to protocol, doing things 100 times and you know how to do them safely. We've spent that takes 30 to 90 days, according to Charles Duhigg, who literally wrote the book on that, right? We've been at this for 14 months. So we've certainly formed some habits and some expectations on the back of that. And then, once it's all said and done, what are the things that enable us to do work well? And we've learned in the past year, safety and health is certainly one of those things, but there's lots of others. So that leads to the bottom 8 trends that we have here, where we see safety and health embedded at the core of the future world of work. But all of these trends here are not new. These are things that were already being driven for a decade or more. And COVID has just put a ton of accelerant under, right? Distributed work teams, new skills and modes of leadership, demographic changes, technology. These are things that are not new, but they're things that we've seen really take flight with COVID.
Super, thank you for that. And it's really helpful to have that structure so that companies don't see this. And what is the phrase? It's not an elephant. Let's look at pieces of the elephant so we can break it down and be useful. So Larry, over to you. You had some fascinating detailed data on how people think about the future of work.
Yeah, absolutely. All right, so this is some interesting stuff here. So, okay, our research suggested that employees want a hybrid working schedule, and that we can expect to see some sort of demand from this, and that they can expect demand from their employers. So about half of respondents want to work a few days remotely and a few days from the office. That is half, basically half of people want some form of flexibility. The flexibility angle is really, really key here. And you can see just how low the 5 days remote is. And this is again, 1,000 employed random Americans that are full-time workers. So it's very, very interesting to see this from our stats here. And one interesting fact is also, we even heard from these industries that require on-site work, like healthcare workers. Even they want to see, 61% said that they would like to explore some kind of hybrid arrangement for their work. And you see this now with like doctors and different types of people, that if you don't need to go to the doctor's office, you can do that from home. And me as a patient, I love that. I can just stay at home and do it, way easier than traveling across town. So I can see the benefit here. Now, let's just go back on kind of how important people feel that they can go back in groups of people and be more flexible as to how often they are in an office. 41% of people said, and this is similar to some of the stats that I said earlier, 41% of people said they would take a job with a lower salary if it meant that they could be able to do this hybrid schedule. Very interesting. They want the flexibility. They're willing to pay for the flexibility. And then of course, always the crowd pleaser, 47% of people said they would literally consider leaving their jobs if their jobs did not offer a hybrid arrangement. The top talent are these people, and the top talent will have choice. And if we do not provide the top talent in every company some form of flexibility that's still practical when they're still getting their work done, there's a lot of problems that companies could be having where they may lose or put at risk their top talent because they see that, hey, everybody else is providing the flexibility, and that's how I work best. So why don't we try this? So I think it's very, very interesting stats, and the hybrid work world, I think, is going to be extremely real. And we're seeing companies adopt this super, super quickly as people figure out what exactly is it? Is it going to be full remote? Is it going to be full at work? Is it a combo? Companies have to discover this for themselves, like was mentioned earlier. And it's very important that people be very deliberate about how they do this.
Well, thank you, Larry. And I really appreciate your looking at Gen Zs, millennials, but not just them, and looking at office workers, which I assume on average would be older than Gen Zs and millennials. And you actually don't see as much of the difference as maybe would have been expected. So with that, let me share the ASU survey experience, and very similar. Trent and Larry, your surveys were very similar in terms of ones who would leave their job if they didn't have the flexibility. We didn't ask it quite the same way, but what we saw from an employer point of view, first of all, what I think is positive news, consistent with your surveys, is 72% extended to offer flexible or at least expanded home from work policies post-pandemic. And we assume that that means currently as well. Secondly, the 68% is interesting. While they said they're expanding it, relatively few people said we can be 100% remote 100% of the time. So to that hybrid environment, the 68% believe employees need to be in the office at 20 hours a week in some way for social interaction, for brainstorming, and otherwise. But this is not happening too soon. 63% today are saying that all of these policies, maybe they're going to happen in the beginning of 2022. I will say I'm going to believe that this is a moving number. Just like vaccination support, it was relatively low. We know the vaccination is out there and safe, and it increased. I suspect if things go well, I'm going to bet that this number comes down, and many companies are going to start going back to the work in the fall and not waiting for January. So for our audience to see those different surveys, I'd like to give some examples. I'm going to hand it over to Nate first to talk about some of what ASU is doing, and then answer some of our questions about how do you support leadership in a hybrid environment and how does it actually work? Nate, over to you.
Great, thank you. So in our survey, we actually just asked employers to describe their anticipated work environment for the future, and almost 70% answered it's either going to be hybrid or virtual. 41% said hybrid and 28% said virtual. So a majority is going to be in that flexible space that everyone's been talking about. As far as ASU's response to COVID, it's been amazing. And so, and going back to the sort of vaccination incentives portion, so ASU tests employees randomly for COVID. And so one of the incentives is if you upload your card, and I know I saw a Q&A is about how do you know if people have actually been vaccinated. So at ASU, you actually upload your information into the system. And then by doing that, you're allowed to not be randomly screened for COVID testing after that point. And so that's just one example.
Yeah, so real rewards in terms of time spent at administration if you've already been vaccinated and prove that.
And
so,
I meant to say one more thing, Mara, is that they allow employees to actually have time off, paid time off, to actually do the vaccination and get the vaccination. And so that's another incentive that I know that has been talked about in this session so far.
Really helpful. So if we recognize that and the positives here, how do we deal with management? How do you support leadership? Because we've talked about mental health, maybe all employees, but supporting particularly more junior employees. But how does somebody lead when 3/4 of their team might be in the at home today, and then switches to 3/4 in the office in the future, but not everybody in the same place? Have you seen that? Give me some examples of where that works, where it doesn't work, and the kind of support for leadership to do that. Larry, you want to start?
Yeah, absolutely. It's really about how do people kind of organize together to make sure that they're on the same days to get that productivity benefit from being together. So it's about organizing the days, it's about organizing who will be there and providing the tooling for the employees to self-organize, for the managers, and even for the team leads if it's a cross-functional team. It's also about kind of when you do arrive to a workplace that there's actually seating available for you. We like to think that, hey, there's going to be all this availability, but one of the #1 concerns that facilities managers have these days is, will I even have enough desks for all the people? We've hired more people over the last year than fit in our current office. What are we going to do about that? So they need ways of managing capacity. They need ways of ensuring desk reservations. They need ways of knowing that there's meeting rooms and there's availability in the meeting rooms for that day, for that size team. And then they just got to make sure all the schedules overlap, and then of course around the PPE and making sure that there's the equipment and that kind of stuff available while we're still in this transitionary period to post-COVID.
Thank you. And then John, to you, and then to Trent. But what I heard is organize together, but allow people to self-organize the details, have the tools ready. And then this concept that Larry brought up of hoteling came in as a Q&A as well. John, can you comment on that?
Yeah, for sure. I mean, that's absolutely what we've been seeing too, and what we're trying to work through. So Larry, expect a call from us at some point in the future as we work through this. But I will say that one of the things that I would say in terms of leadership support, I think it's about open dialogue between the employee and the leadership here. It gets difficult when you start framing things as, this is what the organization needs versus this is what the employee wants. My point of view on this: employees are the organization, right? We're not going to be successful unless we're doing this all together. So I think it's thinking about the cultural dimensions of that. I'm a sociologist by training, so an organizational psychologist by training. So thinking about that dimension of this is really key too. In addition to what the safety ramifications of how you do things are. If your office is primarily now going to be used for meeting space versus people sitting in individual offices because of the hybrid model, especially as we're in this transition period, think about what that means for your COVID protocols, what you need to have in place, versus if you're just assuming people are coming back in the office and they're going to sit in their individual workspaces 90% of the time, because it doesn't sound like that's going to be the case. So that's where we're coming at it from, and we're releasing some tools hopefully in the next couple of weeks to help folks work through the dimensions of that as they stage these returns.
John, Trent, thank you, John. And then Trent, you work with hundreds of thousands of human resource managers who are on the bleeding edge here. What do you recommend? What have you seen as best practices?
So basically what we've seen as best practices, especially at the beginning, maybe not so much as now, but when this first thing started, for the first 4 or 5 months, we found that companies that mandated that their leaders connect with each employee every day, no matter where they're at in the United States, really saw almost no movement at all in engagement and productivity. Because again, they force their leaders to actually communicate with their employees every day. And if they couldn't, for some reason, if their teams were too large, then have an email or communication with everyone. Many companies, as well as SHRM, I mean, we had planned to move to the Slack platform late in 2021. Well, guess what? We accelerated that. And that, whatever tool you use, doesn't matter whatever tool you use that are out there, Microsoft, Teams, whatever it may be, that real-time communication, that's so the forcing of the communication, but also making sure that you're having fun at work. The team builds on, even if they're online, and the fun kind of activities. And what's also really interesting, we found, and SHRM did this, and many other companies did this as well, we maintained our culture. So once a month, we'd have a CEO all hands meeting, and we'd have a hot lunch right after for all 450 employees. We still did that. And the meeting was virtual. Then you had a pizza or whatever you wanted delivered to your door from SHRM to maintain the culture, because we weren't willing to back off the accelerator with our culture. And so, the other really cool thing is, when you do come back to work, celebrate. So I was surprised. I've got an employee who's leaving. Her husband took a job elsewhere and is relocating. And I told my team, I said, listen, we've got a fabulous restaurant right across the courtyard here in Alexandria. Let's go over and have appetizers and drinks on the patio tomorrow at 4 o'clock to send this person off. The team loved it, because again, it's getting back into what we used to do. So where you can celebrate those kind of things. Now, again, we're wearing masks and we're not eating, or we're going to be sitting outside, socially distancing, but those kind of things that we all took for granted are so important to employees right now. So when you get back in, how do you re-engage safely to get your employees back to feeling they're part of the organization that they felt that they weren't during the last 12, 14 months?
That is so helpful. Nate, over to you. What have you seen as best practices? What are the issues that you think we have to be focused on?
Yeah, so in our survey, we asked companies about their future plans for their physical workspace, and a majority, 55%, said they're going to keep it as is, but 27% said they plan to downsize their physical workspace, and 4% said they're no longer going to offer a physical workspace. And then getting to the the topic about culture that Trent was talking about, we asked employers, why was it important to bring employees to the workplace for 20 hours? And the number one reason was it allows for social connections to be created and maintained with their colleagues. And then our fourth top reason was that it contributes to creating and defining a company culture. And so those are two things that I think relate to the topics that we've been talking about.
That is super. So I'm going to summarize here. We have 2 minutes left and have a little bit of fun with the fact that it's 2 F's and 3 T's. What I heard from you is fun, make coming back to work and working fun. Number 2, food is a pretty good thing. So however you could do it in a safe manner, include food. But on a slightly more serious note, 3 T's. 1 is talk. Talk amongst yourselves, talk to your employees every day. Number 2 is technology tools. Ensure that you have the technology, whether that's in the office to make sure that your hoteling concept works and you have a chair, or it's a computer that people are comfortable with and works well, so they're not always sort of, kicking their computer as I was at the beginning of the pandemic, because it is your lifeline. And lastly, maybe the most important T, do it together. Don't assume if you're management that you have all the answers in a bubble, and don't assume if you're somebody on the team that nobody else understands your perspective. Do it together and talk. So with that, I'm going to hand it over to Nate to conclude, but thank you to all of our panelists, including Nate, for the great work on the ASU survey and for sharing each of your surveys. We will do a follow-up and include much information, and Nate will describe.
Great. Well, thank you for attending today, and we hope you enjoyed the conversation and took away some new ideas. The webinar recording will be sent in a post-event email and will be placed under the webinar tab of our COVID Commons website. In the post-event email, you will receive both a link to our report and a survey asking for your input about today's webinar. We thank you for your participation. We encourage you to visit asucovidcommons.com to learn more about the COVID Commons initiatives. And finally, please save the date for our next webinar on Thursday, June 10th at 9 a.m. Pacific, noon Eastern, where we will take a retrospective look at the last year with our Rockefeller experts. They span all functional aspects of the diagnostics arena, including lab, clinical, lab, regulatory, policy, schools, and government. Once again, thank you for joining us today. Take care and be safe.